Now, you've previously said that the current base restrictions could be the worst of all worlds. What do you mean by that?
Well, just to say we're in an extraordinarily difficult position now. There's no doubt that across the whole country, the community transmission is going up. We're seeing hospitalizations going up, and tragically, we're seeing deaths. Some across all of those, a fourfold increase in the last month alone, and that is something that is very worrying as we go into the real winter. Temperatures drop, and we're all indoors more often. Yeah, I think that you're always stuck between an incredibly a rock and a hard place, and you either have to go very early and harder than you may think, and more geographically dispersed than you may think, or you go incrementally, one week after another or one fortnight after another, to try and introduce the restrictions. I am in favour of going earlier. I think that when you go earlier, the restrictions can be less draconian, and you can have a bigger impact on transmission, and critically get that R value down to 1 and below 1. That's what we've got to aim for. That's got to be the objective, because without that, we go into November, December, January, and we're going to see major rises in transmission in the community and hospitalisations.
Talking to Michael Gove, he was pretty clear that he doesn't think that national restrictions, a circuit breaker, is the right thing to do. Do you agree with him?
I don't, but I'm one of the scientific advisors on SAGE. Our job is to offer that advice. Politicians do need, and I'm not a politician. I'm not affiliated with any party. They have an extraordinarily difficult job. They have to take everything into account. If you look at it from, I think, a health and economic perspective, I don't think these are separate. I think they're very aligned. I think the best way of reducing transmission and getting the country back to where we were perhaps at the beginning of September, and then making sure we have test, track and isolate working properly, we have the NHS prepared, and there are things coming along the horizon soon. I do believe the vaccines will be available in the first quarter of next year. I do believe that monoclonal antibodies to treat patients and save lives will be available in the coming months. And it's with that context that I think we need to reduce transmission now, and we need to get ourselves back, reset it at the beginning of September as a country, not in piecemeal, not in fragments across the country, but as a whole country, because transmission is going up across the whole country. It's worse in some parts, but there is no part of Britain now where R is not above 1 and community transmission is increasing.
I'm really keen, actually, to talk to you about the progress on treatments and on vaccines as well. But just to finish on the idea of lockdowns and restrictions, because back in September, SAGE recommended a circuit breaker, if you like, a kind of short, sharp national lockdown. Labour are now calling for a 2 to 3 week circuit breaker to be introduced. Is it too late now for a lockdown that would only last for a couple of weeks?
No, it's never too late. In my view, the best time to do this would have been around the 20th of September, as SAGE advised. That wasn't decided upon then. The second best time to do this is now. And the worst time to do this is at the end of November, when things will have really got considerably worse. So it's never too late. It's better to do it now than in a month's time. And yes, I believe it would have been better to do it 3 or 4 weeks ago.
At the same time, though, people are pretty cynical that restrictions would be lifted after 2 or 3 weeks, particularly if hospitalisations are still going up, and lockdowns come with a real cost too, both in terms of people's actual lives, with people perhaps not going to A&E or getting hospital appointments in the way that they would normally, and also to our health and well-being. That's a problem, isn't it?
There is no easy answer here. Every choice you make has negative consequences, and we all need to be honest about. Anybody offering you simple solutions without a downside, I think, is doing a great public disservice. But if we did have the circuit breaker now, if we did take the community transmission back to what it was in the beginning or middle of September, that would buy us, I believe, 3 weeks of a lockdown, a circuit breaker now. It would buy us time to make sure that, as you say, hospitals were even better organised than they are now, and pay huge tribute to the NHS in the role they've played. But they could be better organised in terms of making sure that people still had access for cancer care, for diabetic care, for treatment of other conditions. And we could have put in place I think, a stronger economic package that would support jobs and livelihoods and support businesses. So we can do all of that if we just stopped the overwhelming transmission that is now going on and will continue to go on. One of the problems we have when we look at the data is you're always looking at the data in the rear view mirror. You see what the situation was up until the 8th of October or the 10th of October, and you have to think through what's coming in the future, not where you've been. So the ONS survey, which is the best data, I think, in the country at the moment, shows that 27,000 people are getting this infection every day. But that was until about the 10th of October. Today, it'll be over 50,000, just as the CMO, Chris Whitty and Patrick Vallance, suggested some 3 weeks ago. It would be at 50,000 new cases every single day across the country. And that's almost exactly where we are. The reasonable worst case scenario that Sage articulated 3 or 4 weeks ago has now been broached. It is worse than the situation that Sage advised on 3 or 4 weeks ago. So that's the scenario we're in today, not a week ago, not a fortnight ago. That's where we are today. A circuit break would take us back at least a month, and that would allow us to prepare to have the political debates, which are inevitable. It would allow us to prepare that economic package, and it would allow us to prepare the NHS for what could be a very, very difficult winter.
You're clearly pretty worried about the situation. You know, at the beginning of the pandemic, the government made a great play of the fact that it was following the science. As a member of SAGE, is the government still following the science?
Yeah, I think it is. I mean, you heard earlier this week the Patrick Vallance talking at number 10. You heard the Prime Minister saying that all options remain on the table. So, you know, the science is part of this, but there is other elements. SAGE is absolutely aware of the fact there are many other considerations to take into account here. I think a circuit breaker would make sense now. I think it would buy time until we can get better prepared for what will be a very difficult winter. And the vaccines and the treatments, I believe, are coming within 3 to 6 months. I think we will start to have vaccines and treatments available. And then the situation, you're then changing the fundamentals of this infection. We're not changing the fundamentals at the moment. We're trying to suppress it. We're trying to get R below 1 and stop community transmission and the inevitable hospitalizations and deaths. But a vaccine and really good treatments completely change the fundamentals. And then this epidemic is in a completely different place.
Let's talk about that, shall we? Because it is nice to offer a bit of hope after all the kind of gloom that it feels like we're talking to about at the minute. There's been an awful lot of emphasis placed on vaccines. You were saying there that you think one could be available in the first quarter of next year. What exactly, what timeframe are we looking at, and who could benefit from those sort of early vaccines?
Yeah, on this, the UK is in an extraordinarily strong position. The vaccine task force that Kate Bingham chairs has done an absolutely extraordinary job. Britain has access to a number of different vaccines across a range of different approaches. Vaccines come in all different styles and approaches, and Britain has got a portfolio of vaccines through which more than one, I'm sure, will come through in the first quarter of next year. I don't believe that the whole population needs to be vaccinated in those first few days or weeks after a vaccine is available. I think it's important to target those who are more vulnerable and, of course, healthcare workers on the front line of looking after patients coming in. So I think in the first quarter of next year, we will have vaccines. We'll have more than one vaccine. It's critical as well, though, that the UK has played a really generous international role here. It's been a major supporter of CEPI for many years. It's been a major supporter of an international coalition called COVAX under the WHO that's coming together to ensure it's not just rich world that will have access to these vaccines, but we will share them equitably globally. And that's crucial. It's crucial. It's the moral thing, right thing to do. It's the equitable thing to do. It's also the best thing to do for us, because as we can see now in Europe, this pandemic will reverberate around the world for a long time until we change the fundamentals and we get out of it. And the only way of changing those fundamentals is through vaccines and treatment. And the UK task force has played an absolutely critical role in making sure Britain will have vaccines, but also we will share those globally, and I think deserves great great credit for that. On the treatment side, yes, I think in fact the treatments may come sooner than the vaccines. The dexamethasone we know about from the brilliant recovery trial in the UK, and we know now that there are coming so-called monoclonal antibodies which will attack the virus and prevent patients getting worse. And those who are already sick, I hope, will reduce and save lives there as well. So you've got two approaches here, vaccines and treatment, which are 3 to 6 months away. We've got to get through the next 3 to 6 months as a country in a cohesive way, and we're much better to do that together than breaking off into regional north-south or political divides. Divided countries tend not to deal well with epidemics. We've known that throughout history. Cohesive, joined-up countries that share the same agenda, that's when you make progress in public health.
It's interesting, isn't it? Because it does feel like a lot of the conversation has revolved around vaccines, but as you say, effective treatments could actually come earlier. If you look at the money, vaccines have been given 6 times more funding than treatment. Do you think that actually we should be focusing more on treatments?
Yeah, we should. You're right, and the vaccine, people see it perhaps as a magic bullet. Vaccines are only ever part of a broader public health agenda. Vaccines are one of the greatest inventions mankind has ever made, but they're only ever part of something else. You need, even when we have vaccines, we will still need good testing. We will still need some degree of isolation in those people that are positive for COVID, and we will definitely still need treatments. I don't think I can name you an infectious disease for which we have a vaccine where we still don't need treatments for it. There will always be people who either don't respond to the vaccine or for some reason did not receive it who will get sick, and you will always want to treat those. So we will need treatments as importantly as we will need vaccines, as importantly as we will need public health measures of some degree of physical distancing for a while yet, as we will need trust in public health, as we will need political leadership. These things are all part of public health. There's no single magic bullet that will bring this pandemic to an end. But if you deploy good vaccines, if you deploy good treatments, and you keep some degree of the public health measures in place now, this pandemic can be turned around, I believe, in the next 6 months, maybe 12 months at a global scale. And that is changing the fundamentals. And at the moment, we're not doing anything that changes those fundamentals.
You're talking about a time frame of potentially 3 to 6 months. How is Christmas going to look like for people, do you think?
I think Christmas, I don't think the vaccines will be ready and be deployed by Christmas. We will have the data on the vaccines, I hope, in November and December and into January next year. Christmas, I think, will be tough this year. I don't think Christmas is going to be the usual celebration it is, and all families coming together, I'm afraid. I wish we could say it was, but I think we have to be honest and realistic to say that we are in for 3 to 6 months of a very, very difficult period. The temperatures drop, we're all indoors more often, we have the other infections that come at this time of year. Much better for us to be upfront and honest now and say we're in for a really difficult time, but there is light at the end of the tunnel. There is light at the end of the tunnel in the first quarter of next year with the starting of coming of vaccines and the starting of treatments. But we've got 3, 4, 5 months to get through until we get to that period. And I'm afraid, yes, Christmas will not feel like a normal Christmas for almost everybody.
Yeah, thank you. It's a very clear timeline that you are setting out, very clear and honest. Just finally, this is a question that I am consistently asking people in the government, and they never give me an answer to it. So I'm just wondering if you might be able to shed any light. And it's about compliance, because it does feel as if, we have these rules and restrictions coming in, but they're only as good as the number of people who actually follow them. Have you seen any data on compliance, and what does it show?
Yeah, in fact, I think compliance is better than people think. And I think that's a really important thing to say, because actually the real R value, this famous R figure, which I think everybody now sort of appreciates, the real R value for this infection, if you do nothing, is probably 2.5 to 3. That's what it was in February and March of this year in this country, which is why we had such a dramatic increase in infections in March and April. With the restrictions in place now, R is probably about 1.5. So you've already had an impact. People are across the country are actually responding very positively to the restrictions. In my view, it's just not quite enough. It's brought the R value of this infection naturally from 3 to 1.5. but 1.5 still gives you an expanding epidemic. And we need to bring that value down to 1. And that's why I believe a circuit breaker is justified. But I think the compliance across the country is much better than people appreciate. And I know there are pictures of bars and restaurants, and I think we have to do something to try and encourage people to reduce further. But overall, people are not mixing as much as they did in January and February. They're not mixing as much as they would normally do at this time of year. And people are still being very cautious. And that is why R is 1.5, not 3. And it also demonstrates that with good messaging, with trust in public health and a cohesive response, you can bring R down. This is not impossible. We can achieve this. And we can buy ourselves this 3 to 6 months until we can change the fundamentals of this pandemic with the vaccines and with the treatment. And then we're in a completely different world.